There's new research that pinpoints the earliest symptoms of colorectal cancer as more young people are being diagnosed with the disease. NBC News medical reporter Erica Edwards has more.
The American Cancer Society says that the number of early onset cancer cases, colon cancer cases, has doubled since 1995. We're talking about people diagnosed with colorectal cancer before age 55. And now researchers at Washington University School of Medicine in St. Louis has uncovered 4 symptoms that might pop up, giving an early indication that someone could be at risk for early onset colon cancer. Let's take a look at those. Number 1 is abdominal pain, rectal bleeding, ongoing unexplained diarrhea that doesn't get resolved after a few weeks, as well as iron deficiency anemia. Now, you generally can't feel iron deficiency anemia, but it is something that is looked at through routine blood tests during your annual checkup. Knowing these signs are important because the number of early onset colon cancer cases has been rising in recent years, especially among people under age 45.
Hey everyone, welcome back to our channel. Did you know that colon cancer is the 3rd most common cancer diagnosed in both men and women in the United States? That's right. Each year, about 150,000 Americans are diagnosed with colon cancer, and it's responsible for over 50,000 deaths annually. As you may have seen from NBC News, early detection can significantly improve your chances of beating this disease. Colon cancer is one of the most common cancers out there, but the good news is that it's also highly treatable if caught early. Today, we're exploring in more details of these early warning signs of colon cancer that you should never ignore. I will also discuss the less common symptoms that you should be aware of. Later, I will share with you what you should do if you notice any of these symptoms and what you can do to catch colon cancer early. Stick around until the end of this video, because knowing what to look for can literally save your life. So, what exactly is colon cancer? Colon cancer, also known as colorectal cancer, starts in the colon or rectum. It usually begins as small, non-cancerous clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can turn into cancer. There are several risk factors for colon cancer. These include age, a family history of colorectal cancer, a diet high in red and processed meats, smoking, heavy alcohol use, and certain genetic syndromes. Let's talk about the early warning signs. These symptoms can often be subtle, but being aware of them can make all the difference. First up, persistent abdominal. This could be cramps, gas, or pain that doesn't go away. Abdominal pain is a common symptom, with studies indicating that about 40% of colon cancer patients experience this. It's important to listen to your body and recognize when something doesn't feel right. Do you often feel like your bowel doesn't empty completely after a bowel movement? This can be both physically and psychologically uncomfortable. Around 30% of colon cancer patients report this sensation. It's another subtle sign that shouldn't be ignored. Next, blood in your stool. This can appear as bright red blood or darker stools, which might indicate bleeding higher up in the colon. According to research, about 90% of people with colon cancer notice blood in their stool. It's a scary symptom, but one that definitely needs immediate attention. Feeling unusually tired or weak. Colon cancer can cause anemia due to blood loss, leading to fatigue. Recent studies have shown that fatigue is a symptom for about 60% of people with colon cancer. If you're feeling worn out for no apparent reason, it's worth discussing with your doctor. Also, changes in your bowel habits. If you notice persistent diarrhea, constipation, or a change in the consistency of your stool, it could be a sign of colon cancer. Studies show that about 74% of people with colon cancer experience changes in their bowel habits. It's something many people overlook, attributing it to diet changes or stress, but it's worth getting checked out. Unexplained weight loss is another key symptom. Cancer can alter your metabolism, causing weight loss even if you're not trying to shed pounds. Statistics reveal that about 38% of colon cancer patients experience significant weight loss. So if you notice those pounds dropping without a change in your diet or exercise routine, it's time to get it checked. Now, there are also some less common symptoms that you should be aware of. For example, narrow stools. This could indicate a blockage in the colon caused by a tumor. If you notice this change, it's worth mentioning to your doctor. Changes in appetite can also be a sign. If you're feeling full quickly or just not hungry as often, it might be related to colon cancer. Lastly, a persistent urge to defecate without result, known as tenesmus, can be a symptom of rectal cancer. So what can you do to catch colon cancer early? Screening is crucial. There are several screening methods available, including colonoscopy, stool tests, and CT colonography. The American Cancer Society recommends that people at average risk start regular screening at age 45. Those with higher risk factors may need to start earlier. Early detection is key to successful treatment. Studies show that when colon cancer is found at an early stage before it is spread, the 5-year survival rate is about 90%. So regular screening can truly be a lifesaver. What should you do if you notice any of these symptoms? The first step is to see your doctor. It's important to prepare for your appointment by noting any symptoms you've been experiencing, how long they've lasted, and any other health changes you've noticed. Your doctor might recommend diagnostic tests such as a colonoscopy, blood tests, or imaging tests to get a clearer picture of what's going on. Don't be afraid to ask questions and express your concerns. All right, let's recap. We talked about the key warning signs of colon cancer, including abdominal pain, blood in the stool, weakness or fatigue, ongoing diarrhea, and unexplained weight loss, a feeling that your bowel doesn't empty completely. We also covered some less common symptoms and the importance of regular screening. Remember, it's always better to be safe than sorry. If you notice any of these symptoms, don't wait. Make an appointment with your healthcare provider. Early detection can save your life. Thanks for watching. If you found this video helpful, please subscribe to our channel for more health tips. Stay healthy, stay informed, and see you next time.